Hi everyone, welcome to our nurses interview questions for India. In this video guide we have included 10 multiple choice questions with answers for those preparing for nurses interview. Besides, each answer comes with an answer reference, and that will help you to answer any other questions related to the same topic. We recommend you to take our 25 questions online test after completing this section and check your score. Questions and options will be shuffled and given when you take an online test, and this challenge will really help you to thorough the answers. You can take test from the first link in the description. Question 1. Choose 2 from the given below, the correct guidelines for nursing documentation. Option A, provide subjective information only. Option B, document calls made to other healthcare providers. Option C, use red ink for narrative documentation. Option D, do not leave blank spaces on documentation forms. Option B and D are the right answers. Document calls made to other healthcare providers, and do not leave blank spaces on documentation forms. The purpose of complete and accurate patient record documentation is to foster quality and continuity of care. It creates a means of communication between healthcare providers and members about health status, preventive health services, planning of care, prescribed treatment, and delivery of care. Question 2. Which of the following a nurse should understand as a complication of wound healing when a patient has an open wound on the upper thigh? Option A, hematoma. Option B, aneurysm. Option C, oliguria. Option D, pyuria. Option A is the right answer. Hematoma. Hematoma is a large accumulation of blood on the body part due to trauma, injury, or surgery. Naturally, it absorbs into the body like a bruise. However, in some situations it may need surgical draining, depends upon the size, location, and the cause. Hematoma can impair the wound healing by increasing the wound tension and reducing the tissue perfusion. The chronically draining hematoma serves as a culture medium that can lead to deep infection. In addition, a large, tense hematoma can cause neurological impairment by creating a mass effect on the surrounding nerves. Question 3. In your opinion, a patient must be monitored to prevent which of the following during rapid rewarming process occurs after cardiac surgery? Option A, vasodilation. Option B, vasoconstriction. Option C, spasms. Option D, hypoxia. Option A is the right answer. Vasodilation. During cardiac surgery, cooling of the patient's blood is necessary to reduce the need of oxygen to protect the brain and other major organs damage while the heart is stopped for the surgery by connecting the heart to a heart-lung machine. However, this blood will be rewarmed towards the end of the surgery. Rapid rewarming may be associated with after drop, which results when warm blood shunts to the periphery and cold blood to the core due to vasodilation. Monitoring both skin and the core temperature is recommended to avoid this phenomenon. Question 4. You are conducting a health promotion program regarding testicular cancer to community members. Which of the following symptoms you should pay more attention to and should provide more instructions if necessary when a member attending states? Option A. Swelling of the testicular area without pain. Option B. Heavy sensation in the scrotum. Option C, back pain. Option D, alopecia. Option A is the right answer. Swelling of the testicular area without pain. Testicular cancer is a type of cancer occurs in the testicles or testes, which are located inside the scrotum, a loose bag of skin underneath the penis. The testicles produce male sex hormones and sperm for reproduction. Nearly all testicular cancers begin in the germ cells, the cells in the testicles that produce immature sperm. What causes germ cells to become abnormal and develops into cancer is still not known. Question 5. Choose the correct answer from the following. An indentation, which is 2 mm deep and does not last long. Option A, no pitted edema. Option B, mild pitted edema. Option C, high pitted edema. Option D, severe pitted edema. Option B is the right answer. Mild pitted edema. The difference between an edema and pitting edema is swelling anywhere on a person's body due to excessive fluid is known as edema. The difference between edema and pitting edema is that pitting edema leaves an indentation, even with a gentle pressure over the swelling. Pitting edema is either caused by a localized problem with veins in the affected area, or a systemic problem with your heart, kidney, or liver function. It affects the lower part of a person's body like legs, feet, and ankles mostly. We recommend you to take our 25 questions online test after completing this section and check your score. Questions and options will be shuffled and given when you take an online test, and this challenge will really help you to thorough the answers. You can take test from the first link in the description. Question 6. What is insulin and what does it do in the body? Option A. A hormone produced by the pancreas helps to control blood sugar level. Option B. A hormone produced by the adrenal gland regulates the renal function. Option C. A growth hormone regulates body functions. Option D. A hormone produced by the thyroid glands regulated thyroid function. Option A is the right answer. A hormone produced by the pancreas helps to control blood sugar level. Insulin allows the body to use sugar, which is glucose from carbohydrates in the food that a person eats for energy, and also to store glucose for future use of the person. Insulin helps to keep up your blood sugar level from getting too high, known as hyperglycemia, or too low, in other words hypoglycemia. Question 7. The most common lung function test in COPD? Option A, chest X-ray. Option B, spirometry. Option C, CT scan. Option D, arterial blood gas analysis. Option B is the right answer. Spirometry. Pulmonary function tests helps to measure the amount of air a person can inhale and exhale, and to check whether your lungs are delivering enough oxygen to your blood. Spirometry is the most common lung function test used in COPD. During this test, you are asked to blow into a large tube connected to a small machine, which is called spirometer. Question 8. Fetal alcohol syndrome, FAS, is the consequence of parental exposure to alcohol during pregnancy. Choose the classical symptoms observed in children with FAS. Option A. The frontal lobe of the brain often larger than normal. Option B, hyperactive behavior. Option C, small size for gestational age. Option D. The cerebellum is often smaller than normal. Option B and C are the right answer. Hyperactive behavior and small size for gestational age. Fetal alcohol syndrome is the consequence of parental exposure to alcohol during pregnancy. When a pregnant woman drinks alcohol, some of that alcohol easily passes across the placenta to the fetus. The body of a developing fetus doesn't process alcohol the same way as an adult does. The alcohol is more concentrated in the fetus, and it can prevent enough nutrition and oxygen from getting to the fetus's vital organs. Damage can be done in the first week of pregnancy, when a woman is yet know that she is pregnant. The risk increases if the mother is a heavy drinker. Question 9. A 22-year-old female is admitted to the psychiatric unit with an attempted suicide by repeatedly cut her wrist with a diagnosis of borderline personality disorder. Which of the following behaviors is associated with borderline personality disorder in your observation? Option A, grandiose. Option B, self-destructive. Option C, submissive. Option D, perfectionism. Option B is the right answer. Self-destructive. The borderline personality disorder is a mental illness marked by an ongoing pattern of varying moods, self-image, and behavior. These symptoms often result in impulsive actions and problems in relationships. People with borderline personality disorders also tend to view things in extremes, such as all good or all bad. Their opinions of other people can also change quickly. Question 10. What is the next action of a nurse when the patient has a pulse with weak volume? Option A. Take the client's carotid artery pulse. Option B. Take the client's apical pulse for 1 minute. Option C. Take the client's dorsal pulse. Option D. Take the client's axillary pulse. Option A is the right answer. Take the client's carotid artery pulse. The carotid pulse is taken when the radial pulse is not present or it is difficult to palpate. You can ask the client to sit upright where possible and locate the carotid artery, which is medial to the sternomastoid muscle. This is between the muscle and the trachea at the level of the cricoid cartilage, the middle third of the neck. With the pads of your 3 fingers, gently palpate the carotid artery one at a time. Never palpate the carotid pulses simultaneously, as this will reduce and compromise cerebral blood flow. If you find our pinpointed presentation useful, please like our video. More precise OSCE subjects will be uploaded in the coming days. To get the notification, consider subscribing our channel. Visit our YouTube channel for more clear-cut medical subjects. Thanks for watching.